So what do you do if you find yourself in an emergency situation? Have never used one of those AEDs before. TV9's Emily Schrad joins us live. You talked to a doctor with Mercy this afternoon in Cedar Rapids. What did he tell you about using those machines?
Yeah, Beth, Dr. Ryan Hollenbeck is a cardiologist at Mercy Medical Center here in Cedar Rapids. We went over working an AED like this one that sits just right outside our newsroom. One big thing he told me is that if you've never used one before, the device will talk you through step by step on how to run it. So can you walk me through using an AED for somebody who maybe has never used one and finds themselves in the situation of needing to use one?
Yeah, sure. So these things are designed to be really easy to use and self-explanatory. The most important thing about using one of these is knowing where they're located. So, especially if you're, a coach or something like that, or, even at your place of work, just know where these are located, because if you can't find it, it's not very useful. Once you find it, take to the patient, you just turn it on. And all of these have step-by-step audible cues that walk you through how to use it.
Yeah, absolutely. And for somebody who's never used one for the first time, why is it so important to be able to follow those directions, to be able to use one?
Yeah, so when someone has a cardiac arrest and their heart's not beating, one of the common causes is a rhythm disorder that causes the heart not to beat. And so that, fortunately, is a reversible cause. So if that rhythm disorder is detected and treated rapidly, then the amount of time their heart is at standstill is reduced. And so getting somebody defibrillated or shocked as quickly as possible is one of the key parts of resuscitation.
In a situation where one of these is needed, is that usually life-saving?
100%, yes. This is, like I said, cardiac arrest due to a lethal arrhythmia like ventricular fibrillation, that's one of the things we can actually fix and stop with the defibrillation. You can shock them, terminate the arrhythmia, get their own pulse back, and the shortest amount of time possible that they're without a pulse, the better.
Anything else you want to add when it comes to being able to use an AED to help save someone's life?
I'll just reiterate that you can't use these things unless you know where they're located. So probably a good reminder for all of us to take a minute next time you go to work or wherever you exercise, things like that, and just scan the facility and see where these things are, because hopefully you'll never need to use one, but it's one of the things that if you do need it, you need it right away, and you got to know where it's at.
Like Dr. Hollenbeck says, time is of the essence when it comes to a cardiac emergency. If you're not sure if you should use an AED when somebody is having one of those emergencies, there's a couple steps you can take. First, call for help right away. Then take time to assess the patient. Are they breathing? Are they responsive? Do they have a pulse? Now, if they don't have a pulse, that's when you should send somebody to go get an AED and then start CPR compressions. Live in the newsroom, Emily Schrad, KCRG TV9.